Hello friends. Recently we came across one child, very critical, and it was a very puzzling one, and we're still trying to find out what exactly must have happened, which brought this child to this particular situation. Stay till last in this video and give your thoughts, inputs in the description below, comment section below. If you are new, consider subscribing to this channel Thinkpedia, and for parents, subscribe to my Instagram handle at Thinkpedia Official. My name is Dr. Khanjan Shah. I am consultant pediatric intensivist at Sneh Children Hospital, Ahmedabad. So if I briefly tell you about this child who's 2-year-old girl, and around 10 kg weight. This child basically went to a pediatrician 3 days back for vaccination, and she was found to be very pale. And on interrogation, what pediatrician friend asked to their parents, and they found the child little dull, lethargic, going on for 3-4 days, not much. There was history of some viral illness 15-20 days back. Apart from that, there was no significant history. In past, she was admitted once at 6 months of age with some URI sort of symptoms, and that time her hemoglobin was 12, and after that no reports were there. She was full-term child, no NICU admissions required, and apart from that one hospitalization, she had an uneventful past. She is the only child born of non-consanguineous union, and there was no family history of tuberculosis or recent COVID, travel, etc., which could contribute to the present illness. So in growth and development wise, she was normal for age. So first, when she approached, she went to the pediatrician, and she was found to be very pale, and she was investigated and found hemoglobin of 3. Platelets were around 70,000, and her chest x-ray, as you can see it here, it showed, so x-ray is here, so it showed a huge cardiomegaly. CT scan was done there, the report is here, echo was done here, there, and report is here. So that's when she was referred to Sneh Children Hospital. Now, when we first saw child and the history as I described, she was tachycardic, she was tachypneic, and the very first echo showed a huge pericardial effusion. And rest of the things were here and there. Hemoglobin which was 3, she had received transfusion at the referral point in Morasa, and now at here her hemoglobin was somewhere around 9-10. So the pericardial effusion, we thought of tapping it, and the moment the tap was attempted, there are chances of vasovagal response, but to this degree when you are tapping pericardial effusion was something not known for. But fortunately consent was taken and all emergency measures were at hand. The moment the tap was performed, she immediately, heart rate went from 190 to directly 60-70, and as the echo was, it was an echo USG guided procedure, so pumping was from this went down to like this. So imminent arrest was there. She was given atropine and she could be revived. Dr. Kashyap Sheth sir, pediatric cardiologist, he is involved in the management, and he also did the echo and found to be a huge pericardial effusion. We thought of, and apart from that, there was also LV dysfunction. Her ejection fraction was around 15 to 20%, and huge pericardial effusion, but the tamponade features were not at that point. So it was a consistent decision to wait for a day or so and see if with diuretics and inotropes, if we can get rid of the other failure features, and then we attempted TAP. TAP was attempted after 2 days as there was no difference. Echo was done regularly, and the moment it was the blood. So basically it was filled with blood. Hemopericardium was the condition. It was purely bloody tap, as you can see in the video which I'm playing right now. Child, and it was a sonologist was there, cardiologist was there, and tip position was confirmed that it was in the pericardium itself. It did not pierce the heart at all, and also the fluid, it didn't clot. Again, if someone punctures the heart and if that is being tapped, then it's supposed to clot immediately, but this blood didn't clot at all. So for etiology, a lot of workup was being sent, culture came sterile, it was sent for malignant cells, came negative, tuberculosis, gene expert, stuff like that came negative. So very child eventually improved and went home on meds. EF also improved after 72 hours and 96 hours, and just prior to discharge, her platelets improved to normal, and there was no fall in hemoglobin or hematocrit. And that's when she was discharged recently. We went through the literature and common causes of hemopericardium, commonest being the trauma, and mother was swearing that there was no history of trauma whatsoever. Other causes and infections like Coxsackie and tuberculosis would also lead to hemopericardium, but tuberculosis came negative. There was no weight loss, no family history, and stuff like that. Other causes being malignancy, because there was some low platelets, hemoglobin low, but that fluid was negative for malignant cells. And after 4 or 5 days, again echo was done. The EF improved a bit, but there was no recollection of blood or anything, and that's when she was discharged. So we reviewed about literature and possible causes. Then there are certain cases which I am putting here. This is, as you can see, in 144-year we could get this case where 45-year-old an adult had a hemopericardium following COVID, and this child COVID IgG had come strongly positive, as there was no history or hospitalization, but as we are seeing that most of the kids are positive with COVID IgG. So it's difficult to pinpoint that it was the reason behind this. There was no aneurysm or any vessels which could have ruptured into the pericardium that we could point out. So at this point, child at home on meds, and 7-8 days repeat echo showed there is no refilling of this space, and EF is gradually improving. As I said, etiology wise it looks like a viral. I don't know whether we can stamp it post COVID or not, because in pediatric such reports I could not find. If anyone of you heard of or have come across such cases, then please send me the link of your send me the write-up of your case, and I would definitely like to go through that, and let's hope for the best for this child. Thank you so much for listening to this video, friends.